Before we begin, I'd like to introduce the panel we have here today. First, Mr. Mike McNicholas. Mike is a consultant orthopaedic surgeon at Liverpool University Hospitals NHS Foundation Trust and an honorary senior lecturer at the University of Manchester in the UK. He's president of the UK Biological Knee Society and is currently the chair of the ICRS Registry. Mike has vast experience with patient registries, having had long-term involvement in the National Ligament Registry in England. We also have with us today Professor Elisabetta Kohn. Elisabetta is a consultant orthopaedic surgeon with her main practice in Milan. She also conducts world-leading research at Humanitas University, also in Milan. Elisabetta is president of the ICRS. The registry was launched in 2016 at the ICRS annual meeting in Sorrento. It was designed by surgeons for surgeons to focus on cartilage injury, its natural history and management of outcomes. As opposed to other cartilage registries, it collects data about both low-grade and high-grade lesions which are treated either surgically or non-surgically. It records lesion, location and modality of treatment. Other collected data includes concomitant injuries, operative complications, use of prophylactic antibiotics and brace usage. Mike, can I start with posing a question to you? So, as it stands, are there currently any indicators of national or global usage of cartilage treatments in place?
So we don't really have any good data on how much is going on, and even industry find it difficult to tell us how many cases there are. And so there is an unmet need really, so that we can try and understand how many patients are being treated with which particular treatments. And the real world results are going to be different to those of the amazing randomized trials that you've run in the past. To try and identify if there are treatments that aren't being successful early would be another really valuable contribution from the registry. And if patients are doing particularly well with one technique, with one unit or surgeon, if we can identify that their performance is better than those of the average users of that technique, then we can then look why they're better, and that'll give us a better understanding of that. And if there is a technique that's not performing as well as it was said to in real world use as opposed to trial outcomes, then we should be able to identify that, which has got to be to everybody's advantage. And then it's going to be for all the stakeholders involved, and that's us as surgeons, for scientists, the people that are paying for the services, whether that's a national service or insurance companies. And it's really, really important that all of those stakeholders are given proper information. And so I think the registry is an amazing facility that will allow us to be the go-to place as the ICRS for the best information on outcomes in cartilage surgery.
Excellent. So with that in mind, Elisabetta, what do you propose the benefits are to the surgical community in terms of using the registry?
I think it's a very important question, because it seems that it's something that it's needed by the society more, but in reality, we need it. We need it like an orthopedic surgeons, we need it like a community, because it's registry provides us the unique opportunity to get the knowledge on the things and get the real knowledge of the real understanding of the determinate procedures outcomes, because we can't have it just based on the only industry-based studies or something like this. So we really can have really real evidence with the registry. And it's important not only for the surgeons, it's important for regulatory bodies. So regulatory bodies are really very keen to have data, not from just specific maybe industry-driven studies, but from the registry. So it's our responsibility as the community and orthopedic surgeons to provide this data, but also as an individual benefits. In reality, I think it's very important to have a registry. You can use this registry as like a personal registry.
But I actually like being able to say how I'm getting on now, how that compares to how I got on 5 years ago. And to be able to give real informed consent, as we're supposed to now in a patient-centered manner, you need to know your own performance. And if you're not measuring your outcomes, how can you have an honest conversation with your patients? So, you know, I mean, that's a huge benefit to me. And particularly nowadays, in the litigious age that we're living in, you know, patients will try and sue if you've had a bad result. And there's nothing better than being able to defend yourself with your own data. And that is massively important, and unfortunately, I think, becoming more important.
So we've talked about the benefits of the registry so far, but let's be realistic and think about limitations. So Elisabetta, would you like to comment on this?
You know, registry with any type of data publication can have bias and can have drawbacks. So it's really, it can be a wrong data there, it can be negative data there. So it's for sure the risk. But this risk got decreased wider the data, bigger the data becoming, low is the risk of a potential bias. So it's really, as if many orthopedic surgeons put it inside a lot of data, I think the risks are mitigated a lot. That's why I think it's very important to have a strong registry, because stronger are your big data, bigger your big data, more the data are precise and accurate.
And you know, I mean, whilst there are downsides to collecting data, because it seems like it's going to take time, actually the way that we've designed the ICRS registry, there's minimum input. We're all very busy as surgeons. So all you need to do is point the patient in the direction of cartilage.org. There's QR codes there for them to then be introducing their personal details. The consent for participating in the registry is part of the process of enrolling. And the consenting process is the best standard of everywhere in the world. And so it's fully compliant with GDPR regulations. And so then the patient enters their data. The only input otherwise for the surgeon is to document what happened at the time of surgery, which isn't onerous, doesn't take long. And as with other registry operation data inputs, once you've done a few, it becomes second nature. And you are able to have a series of individual sort of treatments that you use, and then all you need to do is change the size of the lesion, and most of the rest of the text is going to remain similar.
And I think the nice thing as well is that for the patients, they get sent these questionnaires automatically, so there's no work for the surgeon as soon as they've put in the information of the surgery, of the treatment. So, you know, as soon as you've done that, the patients will get an automatic reminder to fill in their proms every 6 months, a year or whatever.
And when you're seeing patients in clinic, they love being able to see how they're performing against how they were before. And also then they can see how they're performing against a matched cohort of data. So the patients like it, and it's really good to be able to say how you are getting on to somebody honestly, and that this is the best way to do that. And in terms of the security of the data, I mean, it's our data, we're going to keep it amongst ourselves. The interpretation of data is really difficult, and so we've got the best brains in cartilage in the world as part of this fantastic organisation, and so we can look at the data and interpret it far more correctly without bias in comparison to maybe industry partners. So industry partners very generously offer to allow you to use their registries, but then when it comes to negative outcomes, they may not be so happy for you to publish on that. So if there are outcomes that are less than ideal, this is the best way to be able to find that and to present it in a truthful manner.
Yes, the independent registry, this is very important to point out.
Absolutely.
So what do you think are the key drivers to the overall success of the registry?
But I think the key drivers are really interaction between all the types of stakeholders. So the interaction between surgeons, patients, researchers, industry. So if it's all together, they are all involved, the bigger is the benefit. So it's really very, very important to get all the stakeholders involved.
And that's the great thing about the ICRS, because it is all of that already. And so having this as a sort of USP, unique selling point, is really important, and it is very important to the society. And when we get that engagement, it's going to be great. And as we gain more data, then people can approach anybody on the steering committee or Gwen as its manager with a research question, which we'll then screen to make sure it's appropriate, and we can supply data to researchers, clinicians, regulatory authorities. So there is, I think, no downside to this. The difficulty that people perceive that it's going to be a time sink isn't a real thing, and the benefits are going to be huge and will accumulate as time goes on.
I think once you try it once, it's getting easier. It's getting easy. It's the difficult thing is come and try and put the first patient inside. Then once you overcome this difficulty, or your collaborators overcome these difficulties, I think it's basically done. Afterwards it's really easy.
And I'm here to help facilitate that. So if anyone is interested and has any questions or feels that there is area for improvement in the registry, then please do get in touch, because we would be delighted to help.
And we've got the information pack that's available, governance packs when people are introducing it to new establishments. And that's all written to the highest standard. And it's been useful for those surgeons who are kindly already contributing. And if we get any comments back about it, then we'll change it. And the registry itself, we sent out a questionnaire as the ICRS at the beginning of 2022. And as a result of that, we've got 30 new contributing surgeons. And we had feedback about things that surgeons might want changed. There was quite a ligament-based emphasis in the way that the data was entered, and on the basis of feedback from members, we're changing that so that you can, if you don't really want to include ligament-related information, you just put a minimum amount in, and you can move on to concentrate on the cartilage treatment. It's also possible to use for outcomes for osteotomies, or any joint preserving treatments, or no treatment. So we don't really know the natural history of the
even
things
injections, whatever, whatever you want to put in, any type of intervention.
So some of the biggest numbers going in last year were in the sort of injection treatments. I think there's about 8 different injection treatments that we've got included now. Huge numbers and very, very interesting information, which as time goes on, we're going to be able to drill down into and start making some really important statements, improve the literature, and the clarity that will come from the big data and its analysis will be brilliant.
So one final question. Now that orthopaedic surgery appears to have restarted post-pandemic, how do you see the future of the registry?
I think the future is really bright. We've got industry partners that are very kindly helping fund it. The ICRS are fully behind it, and it's been difficult over the last few years for everybody. We as surgeons outside of the US, where they didn't seem to get such a big hit and they were able to continue doing their cartilage-based treatments, we hadn't that opportunity. So we've got a lot of patients that we need to treat, and as we're starting to get that back online, then having good habits and entering the data as we go, make it part of our usual day, and it's going to get easier and easier. And then when it comes to, certainly in the UK, appraisal on an annual basis, there's a reporting function within the software, and it gives you a report of your cartilage-based treatments, or if you're using osteotomies, you can say how they're getting on, and that's a really important part of reflecting on your practice and having objective evidence of how you're getting on.
Yeah, that I think is very important now, and now we have Gwen. So please, she can help you with whatever. It's very important you have a person who is dedicated to the registry and which can help you, because it's some of learning curve, but it's not that dramatic learning curve, absolutely. So it's very easy. She can help to the data managers to learn how to use the registry, residents, surgeons, you know, all the possible stakeholders. So it's really important, and she's willing to help.
Yeah, absolutely. So please do get in touch.
Yeah, and we'll be generating the report later this year.
Yeah.
Industry partners can have an individualised report that places their product against the generality of the same area, and there will be any number of publications that will arise out of the data, and be involved. It's part of the society. It's really important, and join us.
Great. Well, thank you very much, both of you, and thank you everyone for joining for this session. We really appreciate your time and hope that you found it informative and useful. So I think it's really clear that we are urging you to get in contact if you have any further questions, and please follow the links and the QR codes via the ICRS website to register. So thank you again.
Thanks very much.
Thank you. Thank you.